Okay, I think we're live.
All right.
You ready?
I'm ready.
All right, everybody. This is Amanda Maynard. I am the resident life coach at Avalon Physiotherapy, and today we're going to be talking about pain-free pain relief?
Drug-free.
Drug-free and pain
relief. Yeah.
Now, today I have with me Estelle Barry. She is the co-owner and chief physiotherapist here at the clinic. And you guys brought in laser, what, 10 years ago?
Mm-hmm.
One of the first organizations or companies to bring it in for general pain management, correct? So Estelle is a little nervous about talking on camera today, so just be gentle with her.
Please.
Please.
Yes.
So I'm going to ask some questions to Estelle based on what I would be asking when I came in, you know, not knowing anything about laser. I'm used to cosmetic laser or surgical laser, but I wasn't really familiar with the laser that they use here in the clinic until, of course, I needed it. And I am one of their regular clients for laser, I'm just saying.
Ah, it's not bad. Not bad.
Yes, which is great, except it's because I have tendency to be a little klutzy and, you know, re-injure myself.
That.
We can't cure klutzy, no. Many have tried. So I'm just going to go through some questions. If you have any questions, if you're watching the video live or following the video, if you're watching the recording, just post them below, and we are monitoring the videos and the questions, and we'll be happy to answer them after or in a later video. So, what are the common uses of the laser that you use here in the clinic?
Okay, the low intensity laser is all about speeding the healing process. So if you had a new injury, like if you fell down the steps or
up the stairs, concrete stairs.
You fell down, bruises, fractures, those kinds of things, anything new, it's going to speed the healing some 40-50%. So lots of times you won't appreciate that because when you injure yourself, you just expect to heal. But in reality, if it would have been a 6 or an 8 week sprain, that it might heal in 4 or 5 weeks. It would be that kind of thing. So it's really good for that. And in that category too, scarring is minimal. So and really well organized so that you don't run into the problems after the injury of sort of delayed healing or improper healing. Those things are all taken care of.
So is it improving the scarring process?
Mm-hmm. Yeah, there will be a minimal scar and it will be really mobile.
Oh, okay.
You know, it doesn't stick to the underlying tissues or anything like that.
Yeah, because some of us have had that for other surgeries and it's not fun.
The other big thing is for delayed or old injuries.
Oh, yes, yeah.
Yeah, and that's where people really, really love it because if you've had pain, you know, again, from an accident or something of that nature, 15 years ago or whatever, it seems to be able to restart the healing process and allow the body to deal with it that way. So it's just all about speeding healing. That's what it is.
Excellent.
Yeah.
So one of the questions I had, because I've had cosmetic laser before, what's the difference between cosmetic laser or surgical laser, as you call it, and the laser here in the clinic? Because cosmetic laser is, if you haven't had it, it's painful.
Well, I think that's probably, on one level, the biggest difference. I could get technical and tell you about the wavelengths and all that kind of stuff, the red light, the infrared light, but the surgical and the cosmetic lasers are very painful. They cut. People can do surgeries with them. The low intensity laser is not that at all. It doesn't hurt in its application, and usually you'll feel better as it finishes and as you leave. So I would say that's probably the biggest thing. It's really cool because just like plants, our bodies have light receptors, and we can use the light, the energy, to restart cell function. So like plants and photosynthesis, you know how they'll grow with light? You know, we can do that too. So that's really kind of, we can use the light as cell fuel or cell energy, and that's what's so cool about
That's
it.
excellent. Yeah, I like that theory. So, or that explanation, I should say. As someone who's had to come in on an emergency basis and get the laser, not just once.
Oh, Amanda, do you want me to say how many times?
No, we're not going to tell anybody.
All right, okay.
I was one of these people who I actually fell up concrete steps and did some major damage to my hands, my knees, my legs, old injuries and new. And I was able to call in and get an appointment for the next morning. Now, I had been icing it all night, but I knew I had done some really serious damage to my hand and the knee was an old injury, and it was getting very painful. So I came in, and they put the laser, they're pads really, they're not, they use some pens, but it's more pads they put over the injuries, and it really took the pain away almost immediately, and the soreness, especially my hand, I had jammed my hand into a brick. Not fun.
Nah, and it takes care of the swelling too pretty quickly.
Yeah.
Yeah.
And it lasted for a few days. I came back in, the following Monday, and it's been really, really helpful. I know from previous injuries that this has been a lot faster healing than previous times.
Yeah. Oh yeah. Over and over again we see that.
Yeah.
Got all kinds of miracles. People who want to go to Europe and, have an injury, sprain their ankle or something.
Yeah.
And, they still have to take care, but it certainly speeds things along a lot.
Now, one of the other things, I know there's this, Claire, the other owner of the clinic, she had broken her wrist, right? She had fallen on the ice.
Yeah, she had. And that's really cool because she ended up having
break
surgery.
isn't cool.
Oh, well, she thought it was cool.
She thought it was cool that she broke her wrist.
No. After the whole thing, she had surgery, and then she went back with her usual recheck to see the specialist. And I guess he must have seen the X-ray before he went out to see her in the waiting room, because he came up to her and he took her hand and he shook it. And Claire said she was kind of surprised that not more happened, But anyway, he said, "It's great, it's healed, go." And then he went on to tell her that he hadn't seen that kind of a fracture heal so quickly in his practice. So, that was a reaffirmation for us. We thought that was very nice.
Yeah. So those are the type, just a couple of the examples of how laser can heal and speed up the healing process for a variety of reasons. If, and if you're curious.
Yeah, probably the other one I might mention is OA, like general arthritis. It seems it really does a nice job with that. Like, by its very nature, it tends to get a little worse over time. But in the sort of mild and moderate stages, it's able to take pain away quite significantly and improve your mobility. And we have a lot of people in the clinic who come in occasionally, like after an initial session of them, of lasers, they'll come in maybe once a month, once in 2 months, and that seems to hold them really well. So they're very happy with it, and that's nice to see like that.
Excellent. So if you're curious about laser, or if it can help you, or anything, call and ask for Estelle, or actually Jessica is probably a good one as well, right? Jessica is the assistant physio here at the clinic, and the laser is covered through your physio insurance, correct? Because you guys are the ones.
Laser is a modality of physiotherapy, and I'm getting kind of old, and it's the very best one I've ever seen. I really like it. It's just a tool, like it speeds the healing. You still need, strength and all of those kinds of things. You can't get away with the exercise ever, but it really, really, really makes a much nicer treatment plan, and usually the outcomes are really strong.
I really like lying on the bed getting the laser versus having to exercise. Just personal experience.
See,
so
some people
you can't fix some people. So again, if you're curious about laser and how it might be able to help you or speed up your healing process, please call the clinic and email us, book an appointment, and someone here would be happy to explain how it may be able to help you. Okay.
Please.
Thanks for watching.
Yes. And if you're curious at all, we'd love to hear from you.
Yeah. Thank you. Post your comments and questions below, and we'll see you the Dr. Laura and Amanda show on Thursday, probably. Okay.
Sounds great.
Okay. Bye, everybody.
Thanks. Bye-bye.